Hey everyone, so we're here to look at the Garland County assessment. Our presentation will be leading by a overall view of the health data of Garland County, and we found some major health concerns for this county. Then we will do an assessment of the Affordable Care Act in which the Garland County is benefiting and also receiving disadvantages from. We're also proposing three possible solutions that can deal with these health concerns.
So to start off, we'll talk a little bit about the Garland County economic performance. So the median household income in Garland County is around 44,000 compared to a national average of around 68,000. So it's quite a bit lower. The unemployment rate is 3.7 compared to a national average of around 10%. So that is better in Garland County. And the poverty rate in Garland is 16.9%, which is higher than a national average of around 10%. So Garland has higher poverty, lower income, but a better unemployment rate. So next we'll talk a little bit about overall health factors and outcomes. So a health factor is something that contributes to health, such as there are modifiable health factors such as smoking status, exercise level, diet, things like that. And then there's non-modifiable health factors, which include things like age and gender. And then a health outcome is after a health intervention has occurred, then what happens afterwards. So examples of that are mortality, remission rates, things like that. So for health factors, Garland is one of the healthiest counties in Arkansas. It ranks in the upper quartile. And for health outcomes, it's also relatively healthy. It's in the second quartile between the 50th and the 75th percentile. And then just a little bit on some mortality rate disparities. These are between men and women, and these are some of the notable ones. So for tracheal bronchus and lung cancer, for females, and these are more trends. So these percentages represent changes from 1980 to 2014. So for females, it's gone up 36.7%, and for males, it's gone down 27.3%. For melanomas for females, that has gone down 19.7%, and for males, it has gone up 46.8%. And for mental and substance abuse disorders mortalities, these are obviously significantly high for both men and women, but more so for females, it's at plus 566.7%, and for males, it's at plus 369.8%. So those have increased by around five and fourfold in the last few decades, respectively. So moving on, we're going to talk a little bit about a few categories for which the people of Garland County rank above average compared to the rest of the state. So the first couple are primary care physicians and mental health providers. So obviously, it's better to have more of these providers if possible. And so the Arkansas average for primary care physicians is around 1,500 citizens per physician, but for Garland County, it's around 1,150, and that is trending up. So Garland's headed in the right direction there. For mental health providers, Arkansas average is 420 people per provider, and Garland County is 370. And then for flu vaccinations, obviously the more vaccinated, the more that'll contribute to overall health. So for Arkansas, the average is 48%, and for Garland, it's 56%. For air pollution, a lower number means cleaner air. So the Arkansas average of 9.1% is a little bit higher than Garland County's of 8.6%. And then the obesity rates are lower for Garland County as well. The average in the state is 35, and in the county is 29. And that one's trending in the right direction also. So in this slide, we'll talk a little bit about some of the factors that for Garland County are below the average in the state of Arkansas. So the first one is premature death. So the average for the state of Arkansas is 9,300, and that's years of potential life lost after age 75 per 100,000 people. And then Garland County's is a little bit higher at 10,900. For violent crime, the average in Arkansas is 516, and Garland County's is 645. For injuries, the average for Arkansas is 83, and for Garland County is a little bit higher at 121. For children under the age of 18 in poverty, the percentage for Arkansas is 22%, and for Garland County is 24%. And then poor physical health days, which is defined as the average number of poor physical health days reported in the past 30 days for a person. The average for Arkansas is 4.8, and for the county of Garland is 5.2. So a little bit of a trend here. These seem to be preventable things such as violent crime and injury, and they're things for which Garland County could use a little bit of improvement.
For Garland County, there's around 99,000 people, so 52% of which are female. So we have a really quite a balance between the gender, male and female. Meanwhile, their age proportion are very leaning towards the 65 years and over, which is about the 24.3% of the total populations. If we compare to the national average, it's only 16.50% of each county. And we're looking at race, most of them are white populations, so the concerns about disparities are very low. Meanwhile, for the health is those who are with disabilities about 15.20%, while those without health insurance are about 12%. So our team has done research about the health concerns in Garland County, and we found that across the board, Garland County is generally healthier than the rest of Arkansas counties. However, we found that there are three main problems regarding to the health issues. So the first one is related to mental health concern. So despite having a lot of physicians, which we have described above, we can see that the self-harm and interpersonal violence mortality rate is much higher than Arkansas and national average, which is at 22 for female, while 70 for male, comparing with 13.3 and 42.6 respectively. Mental and substance use disorder is also higher compared to the national average. We are looking at about 469% changes from 1980 to 2014, comparing with the Arkansas average as well as the national average. And the malignant skin melanoma, which is basically a skin cancer, we can see that there's also a huge difference, especially in the male patients. For stroke, while it is about the same as the Arkansas average, it is definitely higher than the rest of the national average.
The Affordable Care Act was signed into law in March of 2010 to ensure that more Americans had health insurance. Though the ACA has several beneficial principles that have aided underserved communities, the two outlined on this slide best seems to support Garland County. Considering mental health was a noted disparity, ACA ability to address this concern among patients is key to making a healthier Garland County. As for the portion of the ACA that addresses pre-existing conditions, it is safe to say that all of America benefits from this legislation. A major concern and often a potential detriment of ACA is the fear that government-run programs may be less time efficient than privatized programs. This could lead to patients facing longer waiting times in both doctor's office and in emergency rooms, ultimately turning patients off from receiving health care. The ACA does what no other health reforms have been able to do in the past, and that's address the issue of health equity in the United States. Through the implementation of individual mandate, the Affordable Care Act has helped leverage the health insurance field so that all Americans can have access to adequate and culturally competent medical services that are designed to focus on individual need. By providing coverage at an affordable price and sometimes at no cost to uninsured Americans, the ACA has helped close the gap on health care equity in the United States.
Pulling economic and demographic data from our previous slides, we've come up with 3 potential solutions to solve healthcare inequity in Garland County. Our first potential solution for this is increasing access to primary care and just increase public knowledge to let them know that preventative care, can help preventative deaths. So, for example, Garland County is 678 square miles with a population of around 100,000. And after browsing Health Resources and Services Administration map tool, it was clear many of the healthcare providers are centered in Hot Springs. And one example of a potential miss in healthcare coverage in Garland County is Hot Springs Village, which is a notable retirement spot in the state. Does not have a VA. There's a VA in Hot Springs, but there is not one. It's about half an hour away, and there's about 2,500 veterans that are living in Hot Springs Village out of a population of about 16,000. So about 1/6 of the population are veterans. So what we propose is we propose partnering with Central Arkansas Veterans Healthcare Systems, the VA in Hot Springs, to counteract this oversight and coverage for the county by offering mobile clinics at retirement homes. This will make access to coverage easier for retired veterans, thereby minimizing the occurrence of preventable health issues. And moving forward, I'll pass it off to Terrence, and he will cover mental health discrepancies.
We want to briefly highlight more pertinent information regarding mental health challenges amongst those who reside in Garland County, and also note some potential solutions. A shade over 16% of the county's nearly 100,000 residents suffer mental health distress and deficiencies. That places them in alignment with other counties in the state of Arkansas, as their mental health deficiencies are noted as 16% as well. We feel that the largest number of mental health rates are due to addictive behaviors that stem from gambling in Oakland and other casino-type activities. However, unfortunately, Arkansas is one of the 7 states that doesn't spend money spend money to support gambling addiction on recovery centers. It was also recently noted that in a survey that 41% of Garland County's residents reported that they have at least one family member that suffers from anxiety, depression, and other types of bouts with worrisome and anxiety-induced thoughts. In an effort to combat the heightened mental health challenges in Garland County, we plan to breathe life into a public awareness campaign that focuses on prevention, bringing mental health screenings into medical offices, community peer support programs, a gambling addiction clinic, and educational tools for those concerned family members. We will seek support from key stakeholders such as the ADH, Arkansas Department of Health, CMS, Centers for Medicare and Medicaid Services, local legislators, and the Arkansas Department of Health, along with the American Rescue Plan. The third and final solution that we have regarding Garland County is to simply encourage and remind those who are struggling with health deficiencies to utilize the clinics. We also plan to forge a partnership with Oakland casinos and their corporate sponsors. We also want to implement an automatic platform that sends reminder text messages. We want to place advertisements on billboards and place flyers around the casinos. In conclusion, our main concerns are, of course, mental health concerns due to substance and gambling abuse, skin melanoma, and our proposed solutions are promotion and expansion of access to preventative care, those aforementioned mental health programs, and also private corporations. And this concludes our presentation for health disparities in the County of Garland. Thank you.